EMS crews in Wausau go out on nearly 5,000 emergencies each year with just 3 ambulances. The majority of those are for health problems that affect our aging population.
Marathon County 911, Jeremy speaking. What's your emergency?
Our city's paramedics are responding to more and more calls that sound like this.
Alerting Wausau for an ambulance for an elderly, unresponsive female.
In 2011, people between the ages of 81 and 90 were close to 900 of our calls, and people between the ages of 91 and 100 actually made up over 500 of our calls.
As doctors and researchers make further advances in healthcare, our country's 65 and older age group will nearly double over the next 2 decades.
Crews are definitely a lot busier than they were, so we do get stretched a little bit thin at times.
Just because we'll live longer, though, doesn't mean we'll be healthier. Obesity rates are expected to reach nearly 60% in Wisconsin, and that also weighs down on their resources.
As times go on, all we can do is keep an eye on those numbers. Certainly, since we did see an increase of nearly 1,000 calls in the last 9 years, I think if we see an increase in another 1,000 in the next 9, we would have some difficulty responding to that volume of calls with our current staffing.
At area hospitals like Aspirus, it's the same story.
The increase in the number of patient visits has been very challenging for us as far as being able to have adequate staffing.
Emergency rooms and responders are beginning to adapt their care to fit our changing population.
We send extra people, number one, so it's safer for the patient. We obviously don't want to have any incidents where a patient would accidentally get dropped. And number two, it's safer for our paramedics. We don't want 2 paramedics trying to lift a patient that might weigh 400 or 500 pounds.
We will have a case management nurse stationed right in the emergency department that will be able to assist elderly patients in securing enough community resources so that they can remain at home and prevent readmissions to the hospital.
Now, despite those cost and life-saving measures, there's no doubt we'll pay the price. Medical bills, wait times, and taxes will most likely go up to help hospitals and fire departments meet our growing needs.